National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, Naturopathic Doctor Jonathan Beatty here, health expert with Nationalnutrition.ca. One of the toughest concerns men have to talk about is impotency, or what we commonly call erectile dysfunction, or ED. Impotency is essentially defined as the inability to get or maintain an erection adequately. So it's not always just like complete loss of an erection. It can be where an erection cannot be sustained. That is also considered erectile dysfunction or impotency. Now, impotency or erectile dysfunction has a number of causes, and none of them are related to a lack of intake of the little blue pill. Impotency can be caused by medications and smoking. Those are two of the most common causes. If it's a medication side effect, speak with your doctor, talk to them, see are there any other options that you might be able to investigate, or some drug alternatives that may not have that as a side effect. Also, if it's smoking, maybe it's time to consider quitting smoking. You can see the harm that it's doing to your cardiovascular system, because essentially impotency is caused by impairments in blood flow into the penis. It's an early sign of cardiovascular disease, and men who suffer from erectile dysfunction are at a much higher risk of having a heart attack. So yes, it's going to ruin your sex life, but it may ruin your life altogether if you do have a heart attack. So it is something that you have to take seriously if you are showing signs of erectile dysfunction. Now, if your causes are not medication, they're not smoking, the other common causes for them are, of course, poor circulation, stress, and low testosterone. So there's a few things we're going to talk about that can help you remedy these three factors. So circulation, again, erectile dysfunction is a sign of a circulatory disease. So you're going to want to ensure that your circulatory system is working optimally, and some of the easy ways to do this: intake of arginine. Arginine is an amino acid that actually gets turned into nitric oxide, and nitric oxide allows the arteries to relax, thus allowing the penis to fill with blood and allowing a man to maintain an erection. So using arginine acutely can be very beneficial. Also, things like fish oils help to ensure that there's no platelet stickiness, and that can actually help to release arteriosclerosis, and that can help to improve blood flow in the body. So that would be something else to consider. And the herb ginkgo biloba, because ginkgo increases blood flow to the extremities. Many people think of it as a herb for memory. More important, it's a circulatory herb. It helps increase blood flow to all the extremities, the fingers, the toes, and of course the penis as well. And so ginkgo biloba can also be very effective at helping to manage impotency that's due to this poor blood flow. Now, if your problem is related to stress, stress is a major cause of erectile dysfunction. Stress does two things. A, it can basically change the way blood flow works, and it'll decrease your sex drive. And as well, when somebody's under stress, when a man's under stress, it actually increases the conversion of testosterone to estrogen and can actually be the cause of the low testosterone. So ensuring that your gland that regulates stress works properly, this is your adrenal gland, is very important. And two quick herbs that somebody might look at supplementing with are ginseng, which is known for invigorating and giving energy. That one can be very important, as well as rhodiola. Rhodiola rosea, well studied at being able to reduce cortisol, your stress hormone. So it's a great way to help modulate and eliminate excessive stress on the body. Now, when it comes to testosterone, this is a little bit of a tougher one to manage. However, there are two herbs that are very effective, especially when combined. What I like to use for people with low testosterone is something called Tribulus terrestris. Not because it raises testosterone. The evidence is not there that it raises testosterone. How it works is it increases your body's sensitivity to the testosterone. It increases testosterone receptors, and that's the key, so that your body can do more with less. And by increasing the testosterone receptors, you increase your testosterone response, and that's what you're really looking for. And then the other herb I'll often combine that with is something called Tongkat Ali, or Malaysian ginseng. Its Latin name is Eurycomia longifolia Jack. And this herb has been well studied to actually be able to raise testosterone levels and has been well studied to alleviate the symptoms of erectile dysfunction. Combining a lot of these herbs together can be very, very effective at controlling erectile dysfunction. A few other things to consider: B vitamins, as your B vitamins are required for healthy circulation as well as a healthy stress response. And also consider selenium. Selenium is involved in proper sperm production, but it's also involved in proper detoxification and elimination of things that can cause what we call vasoconstriction, or tightening of the arteries, which can impair blood's ability to get into the penis. So those are some other nutrients that you might consider supplementing in addition to the herbs I listed. So if you suffer from erectile dysfunction, hopefully some of these hints and tips will help you suffer no more. Check out more of our videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.